the unseen risks of untreated Crohn's disease. Why biologics often outweigh the alternatives for individuals recently diagnosed with moderate to severe Crohn's disease. The prospect of starting biologic medication can be daunting. Drug labels list numerous potential side effects, from rare infections to theoretical cancer risks, leading many to perceive these advanced treatments as inherently dangerous. However, gastroenterologists emphasize that the decision isn't simply about weighing those risks in isolation. It's about comparing them to the irreversible consequences of uncontrolled Crohn's disease. Modern IBD care increasingly recognizes that the danger of unchecked inflammation leading to permanent gut damage often far outweighs the relatively low probability of serious biologic side effects. This isn't about dismissing concerns, but placing them in perspective. The cumulative damage of uncontrolled inflammation, Crohn's disease, is a chronic inflammatory condition that progressively deteriorates the digestive tract if left untreated. Early, sustained control of inflammation is vital, not just symptom relief. According to Alan Moss, MD, Chief Scientific Officer at the Crohn's and AMP Colitis Foundation, prolonged inflammation triggers the body's attempt to heal by forming scar tissue. Over time, Dr. Moss explains, this scarring transforms inflamed tissue into rigid, narrowed segments known as fibrotic strictures. These aren't reversible. Once established, they persist. Worse still, unchecked inflammation can penetrate the intestinal wall, creating tunnels, fistulas, to nearby organs or abscesses filled with pus. These complications often emerge within the first few years of uncontrolled disease. Data suggest over half of Crohn's patients develop strictures, fistulas, or abscesses without effective treatment. Perianal fistulas alone affect roughly a third of those with Crohn's over their lifetime. Beyond the gut, unchecked inflammation can lead to malnutrition, anemia, and an increased risk of colon cancer, as well as inflammatory issues in joints, skin, eyes, liver, and kidneys. Biologics, targeted treatment in a new era biologic medications, represent a shift in Crohn's disease care. From 2011 to 2020, biologic prescriptions rose from 1 in 8 patients to 1 in 3. These lab-created drugs target specific parts of the immune system involved in inflammation, rather than broadly suppressing immunity like older treatments such as corticosteroids. Anna Sheth, MD, a gastroenterologist at Penn Medicine Princeton Health, notes this precision. Biologics are antibody-based treatments that control inflammation in very limited areas. The American Gastroenterological Association now recommends earlier biologic use in moderate to severe cases, rather than delaying until other medications fail. Waiting for symptoms to worsen only allows the disease to progress unchecked. A 2023 review of clinical trials confirms biologics are effective and safe for this purpose. Weighing the risks, infection versus irreversible damage, the primary concern surrounding biologics is potential side effects, serious infections, and, rarely, cancer. But gastroenterologists argue that these risks must be contextualized. The chance of serious infection is low, a few cases per 100 patients annually, and lymphoma risk is even lower, a few extra cases per 10,000 per year. By contrast, Crohn's disease is relentlessly progressive without treatment. Historically, over 70% of patients required bowel surgery within 10 years of diagnosis. Since biologics became widespread, this rate has fallen to approximately 26%. Biologics may feel like heavy medication, Dr. Moss says, but doing nothing carries serious risks: ongoing inflammation, hospitalizations, and potential surgery. The decision must be made based on individual circumstances. Newer biologics, a more refined approach. Several biologic classes exist, each targeting different immune pathways. Anti-TNF drugs, the first widely used, have a long track record but may carry slightly higher infection risks due to broader immune suppression. Newer IL-12/23 and IL-23 inhibitors offer more targeted action. With newer IL-23 inhibitors like Stelara and Skyrizi, Dr. Moss notes, trials suggest fewer serious infections and better long-term stability. This gut-focused approach may reduce systemic side effects. A 2022 study found these newer biologics equally effective as anti-TNFs, with comparable remission rates. Minimizing risk through vigilant monitoring. Doctors mitigate biologic risks through comprehensive pretreatment screening, blood tests, X-rays, vaccine review, therapeutic drug monitoring, regular blood work to maintain optimal levels, and adherence to safety protocols, avoiding unnecessary drug combinations, ensuring vaccinations. Some doctors offer trial periods to assess individual response and tolerability. I'll tell them, try it for 3 to 6 months and see what it does for your diarrhea, abdominal pain, energy, and quality of life. Dr. Sheth explains. If the benefits aren't enough or they have side effects, we can stop it. These strategies have made biologic therapy safer and more predictable than ever before. In conclusion, while untreated Crohn's disease inevitably leads to progressive inflammation, irreversible gut damage, and systemic complications, biologic medications offer a targeted, often more effective alternative. The decision isn't about eliminating risk entirely, but weighing the known dangers of uncontrolled disease against the relatively rare but manageable side effects of modern biologic therapies. Careful monitoring and open communication with a gastroenterologist are essential to maximizing benefits and minimizing harm.